Seminar number 9, Retrospective Strength. Arthur Bloch is credited with saying, enough research will tend to support your conclusions. Some inflexible defenders of evidence-based medicine feel retrospective studies are not that useful because they only serve to support an investigator's preconceived notion of truth in the universe. Yes, many retrospective studies are limited by significant bias. However, that overall criticism of retrospective studies is unfair because not all questions can be ethically or feasibly answered in a prospective fashion, and many excellent retrospective studies have been able to infer truth in the universe. For instance, so much toxicology research depends on retrospective analysis because it is unethical to poison subjects prospectively. And we've already mentioned Don Berwick's thoughts on randomized trials in his 2008 JAMA editorial. The randomized clinical trial is a prospective study by nature. During this seminar, we will focus exclusively on the retrospective study, and we will discuss strategies to help you improve the strength and quality of your retrospective approach. Some retrospective study designs familiar to all of us include the case series, the case control, and the retrospective cohort. These all rely on clinical data already recorded on charts before the study was even planned. Advantages of the retrospective study include the fact that they are inexpensive, the data is already charted, they can be completed rather quickly, and the retrospective study enjoys a relatively easy journey through the IRB committee. The big disadvantages include sampling bias, abstractor bias, and analytic bias. Subjects are not randomly selected in retrospective studies. How representative are the subjects and their data of the general population are questions that are always asked when retrospective studies are evaluated. For those planning on conducting a retrospective study, this paper by Gilbert is a must-read. Chart Reviews in Emergency Medicine Research, Where Are the Methods? This is published in the Annals of Emergency Medicine in 1996. This paper is available for download at our website. It is short. It describes the basic shortcomings of retrospective studies and chart reviews, which are basically retrospective studies, and this paper provides a template for carrying out an exceptionally strong, robust, and high-level retrospective study. The elements that ought to be considered by an investigator before the study is carried out include the following. Training. Chart abstractors need to be trained in order to perform their jobs well. Explicit protocols need to be determined for case selection, for those cases determined to be included in the study. Variables need to be defined precisely. A standardized data abstraction form should be developed to help guide data collection. Periodic meetings need to be held with chart abstractors and study coordinators to resolve disputes and review coding rules. The performance of the chart abstractors needs to be monitored. Ideally, the chart abstractors are blinded to the study question. This minimizes bias when abstracting data from charts, and testing of inter-rater agreement needs to be done. This is also known as inter-rater reliability testing. What does that mean? Do two or more observers using the same method obtain the same results? We've all had the experience where two clinicians review the same clinical chart and interpret the data differently because of legibility concerns or because of the language used. The kappa calculation is one of the most commonly used inter-rater reliability statistics. A kappa score of 1 implies perfect agreement, whereas a kappa score of 0 implies agreement was no better than chance between the two data abstractors. It is important to include some kind of inter-rater reliability in a manuscript that is submitted to a journal if that manuscript uses a retrospective methodology. I think retrospective studies provide investigators a terrific and easy opportunity to recruit students and residents to function as research assistants. This provides juniors an easy research opportunity. This fulfills the need for blinded abstractors. This allows for inter-rater reliability assessment, and it provides a terrific mentorship opportunity for principal investigators. Abstracting data from a large registry or from a lot of charts can be tedious and time-consuming. Students and residents seeking some research experience and a letter of recommendation would be more than happy to help. So consider recruiting RAs for your next retrospective study. That way, all win in the end. It is important to mention data registries at this time. If given access to a data registry, use the same systematic retrospective approach. Before starting, become familiar with the organization of the data registry so that variables can be defined precisely, so that an abstraction data sheet can be developed appropriately. Discovering meaningful findings among piles of information can be extremely challenging. Data registry studies are extremely popular today, so make sure you use a systematic and consistent and organized approach to abstracting data from that registry in order to have some meaningful findings at the end of your study. In the next seminar, we will talk about the elements of a cohort study.